Hello and welcome to the topic food poisoning, where we will be discussing bacterial and scombrotoxin poisoning in the module Gastroenterology and Hepatology. By the end of this topic, you should be able to define food poisoning, discuss the pathophysiology of food poisoning, explain the clinical presentations of a patient who presents with food poisoning, outline the investigations in the diagnosis of food poisoning, and finally, discuss the principles of management of food poisoning. Let's get started. Food poisoning is defined as an illness caused by the consumption of food or water contaminated with bacteria or their toxins, or with parasites, viruses, or chemicals. The most common pathogens are norovirus, E. coli, Salmonella, Clostridium perfringens, Campylobacter, and Staphylococcus aureus. Scombotoxin poisoning, also known as simply scombroid, is a foodborne illness that typically results from eating spoiled fish. Symptoms may include flushed skin, headache, itchiness, and blurred vision. We will be discussing this a little more in detail in the upcoming slides. So, as for bacterial food poisoning, bacteria here is responsible for approximately 75% of the outbreaks of food poisoning. The Center of Disease Control estimates that 97% of all cases of food poisoning result from improper food handling. About 80% of cases result from food prepared in commercial or institutional establishment, and about 20% of cases result from food prepared at home. So the most common causes are leaving prepared food at temperature that allowed bacterial growth, inadequate cooking or reheating, cross-contamination, and infection in food handlers. Cross-contamination may occur when raw contaminated food comes in contact with other foods, especially cooked foods, through direct contact or indirect contact on food preparation surfaces. So when it comes to the pathophysiology, although the GI tract is the primary tract, the autonomous nervous system disturbances and CNS impairment are prominent manifestations in chemical-related, plant-related, and seafood-related poisonings. The severity can vary depending on the pathogen. How about scombroid fish poisoning? Scombroid is caused by accumulation of histamine in certain dark meat fish. These fish contain high amounts of histidine in their muscles. Histamine is formed from histidine by a decarboxylase from certain bacteria that are present due to contamination from handlers. Scombroid fish contain a chemical called histidine, and here what happens is that the bacteria multiplies in fish thawed in warm conditions and turn the histidine into scombotoxin. The main component of scombotoxin is histamine, which is responsible for the symptoms of scombroid poisoning. The symptoms of bacterial food poisoning vary in degree and combination. This may include abdominal pain, and it's most severe in inflammatory processes. Vomiting is a major presenting symptoms, especially in Staphylococcus aureus. Diarrhea, which usually lasts less than 2 weeks. Headache, and fever, which may be an indicator of invasive disease or an infection outside of the GI tract as well. As for scombroid food poisoning, there are some additional symptoms to take note of. And apart from gastrointestinal disturbances, one can also have cold-like symptoms, headache, itchiness, and blurred vision. As for signs, bacterial food poisoning produces somewhat bloody or stool mixed with mucus. One may also experience reactive arthritis as seen in Salmonella, Shigella, Campylobacter, and Yersinia infections. And one could also have bloating sensation, which gives rise to abdominal distension. As for scombroid signs, the first signs of poisoning suggest an allergic reaction with these symptoms. So one may actually have facial rash, which is intense in itching, which may accompany the rash. One may also have flushed skin. There may be torso or body rash, and this is The kind of rash that is associated with scombroid poisoning is a form of urticaria and most commonly does not include wheals. One could also have edema, short-term diarrhea, abdominal cramps, and flushed skin as mentioned earlier. So the additional signs to look out for in bacterial food poisoning is rare cases, this poisoning may even result in death, and keep an eye on looking for somewhat form of reaction such as having swelling of the tongue, respiratory distress, or blurred vision. Other things you want to look out for in scombroid additional signs would be edema as well as tachycardia if they're dehydrated. When it comes to investigations, there's some pertinent tests that can be done. A full blood count with differential count gives you an idea to what sort of infection it could be. Serum electrolyte assessment as well as blood urea nitrogen and creatinine levels give us an idea of the severity of dehydration. Other lab studies can be helpful in cases of food poisoning, which include stool microscopy, gram staining, and loveless methylene blue staining for white blood cells, which help differentiate invasive disease from non-invasive disease. Microscopic examination of the stool to detect any ova and parasites, bacterial culture for enteric pathogens, blood cultures in febrile patients, and Clostridium difficile assay, which help to rule out antibiotic-associated diarrhea in patients receiving antibiotics or in those with a history of recent antibiotic use. As for imaging studies in food poisoning, obtain a flat and upright abdominal radiographs if the patient experiences bloating, severe pain, or obstructive symptoms, or if the clinical picture suggests perforation. Consider performing the following procedures when a stool examination is non-diagnostic, especially in immunocompromised patients. And among the functional studies that can be carried out would be sigmoidoscopy or colonoscopy with biopsy, and esophageal gastroduodenoscopy with duodenal aspirate and biopsy. And in patients with bloody diarrhea, sigmoidoscopy can be useful in diagnosing inflammatory bowel diseases, antibiotic-associated diarrhea, shigellosis, and amoebic dysenteric even. Because most cases of acute gastroenteritis are self-limiting, specific treatment is not necessary. Strict personal hygiene should be practiced during the illness, and some studies have quantified that only 10% of cases require antibiotic therapy. The main objective is adequate rehydration and electrolyte supplementation. While this can be achieved with either an oral rehydration solution or intravenous solution. Oral rehydration is achieved by administering clear fluids and sodium-containing and glucose-containing solutions. As for intravenous solutions, these are indicated in patients who are severely dehydrated or who have intractable vomiting. You may also provide anti-secretory agents such as bismuth subsalicylate. This is useful and the dose is about 30 ml every 30 minutes, not to exceed 8 to 10 doses. Antiperistaltic drugs should not be used in patients with fever, systemic toxicity, or bloody diarrhea, or in patients whose condition either shows no improvement and further deterioration. If symptoms persist beyond 3 to 4 days, the specific etiology should be determined by performing stool cultures. If symptoms persist and the pathogen is isolated, specific treatment should be initiated. Empiric treatment can be given in patients with suspected traveler's diarrhea or dysenteric or systemic symptoms. The treatment with an agent that covers Shigella and Campylobacter organisms is reasonable in patients with diarrhea for more than 3 days with fever, abdominal pain, vomiting, headache, and myalgias. So you may consider a 5-day course of fluoroquinolones such as ciprofloxacin, and that could be the first-line therapy. Bactrim is an alternative therapy, but resistant organisms are common in the tropics. So infections with either cholera can be treated with fluoroquinolone or with doxycycline. In the absence of dysentery, do not administer antibiotics until a microbiologic diagnosis is confirmed and E. coli is ruled out. Most foodborne illnesses are mild and improve without any specific treatment. However, some patients who have severe disease require hospitalization, aggressive hydration, and antibiotic therapy. Specific treatments for scombroids, they come in the form of supportive care mainly. If lightheadedness occurs, a person should lie with feet partly elevated. Antihistamines such as diphenhydramine can be given. Epinephrine combined with a steroid can be given for severe symptoms. So here in summary, we have looked at bacterial food poisoning, and this takes place when one consumes bacterial contaminated food. We have looked at the pathophysiology and causes, simple clinical manifestations which may seem to be slightly different from scombroid poisoning, investigations that can be carried out, and finally, management approach. And not forgetting for chromotoxin poisoning, we can understand that this takes place when one consumes spoiled fish due to the toxin release from the fish. And here take note of the characteristic rash that one may present with in chromotoxin poisoning. Not forgetting if there are severe symptoms, one should initiate epinephrine as well. We have come to the end of this topic. Thank you.